Hi, I'm Johnny. I'll be your student physical therapist today. So what we're going to do is go through a few things to check your balance, how you're moving around, okay?
Excellent.
So the first one we're going to do is I just want to see you sitting there and see how your sitting balance is, okay? And we'll sit up to 5 minutes to see how you're doing. All right, good job. So that was 5 minutes. All right, so the next one, I'm going to have you stand up and you can grab one hand here. And I want you to, we're going to stand for about a minute. So go ahead and stand up. All right, so that's been a minute. You did good. All right, so this next one, I'm going to have you standing without any support, and I want you to have your arms above shoulder level and just moving your arms around above shoulder, okay? Whenever you're ready. We'll do this for a minute. Go ahead. And relax. Good. That was a minute. All right, so now what we're going to do is I'm going to have you stand on each leg, so single leg. So we'll start with your good leg, and we're going to stand for 10 seconds whenever you're ready. And time. Good. And now on your paretic side, so on this right side, for 10 seconds if you can. And time. Good. Okay, so now what I'm going to have you do is I'm going to have you just roll on to this affected side, onto your bad side, just over towards me, whenever you're ready. Okay, good. And now roll back onto your back. And now I'm going to have you roll onto the opposite side, whenever you're ready. Good. Okay, so now what I'm going to have you do is go from laying down to sitting up on the side of the table here, whenever you're ready. Good job. Okay, now I want you to do the opposite. So go from sitting back to laying on your back. Awesome. Okay, so the next one, I want you to just stand up from that position. Good. And now sit back down. Good. All right, so now I want you to stand up. And now I want you to pick that pencil up off the floor and stand back up. Good. The PASS assesses a patient's ability to sustain postural control and balance during 12 tasks of maintaining or changing positions. The PASS is most sensitive for assessing postural control within 3 months post-stroke. Each task is rated from 0 to 3, with a final score of up to 36. The PASS takes less than 10 minutes to administer, so is a quick assessment compared to others and requires no specialized equipment, so it can be utilized in any setting. Studies have found a ceiling effect in using this measure with higher functioning stroke patients, so it should be used with more moderate to severe stroke patients to better show detectable change over time. Measures such as the mini-BEST test, Berg, or FGA are better suited for a higher functioning stroke patient after a minor stroke, while a test like the trunk impairment scale would better suit a patient after a severe stroke. A score of above 12.5 on the PASS has been shown to be predictive of ambulation post-discharge, and the minimal detectable change for this measure was found to be 1.8 points for an acute stroke, 2.2 points for a subacute stroke, and 3.2 points for a chronic stroke.